There's a moment I'll never forget. An older gentleman sat across from me in my clinic, holding a small plastic bag full of prescription bottles. His eyes were tired, but more than that, he looked confused and overwhelmed. "Doctor," he said, "I don't even know what half of these pills do. They tell me they're for my kidneys, but I'm scared they're hurting me." His fear was not unusual. Many people over 50, perhaps even you, feel caught in that same storm, taking medicine after medicine, without really understanding what's going on inside the body. Yet these little pills can mean the difference between independence and decline, between protecting your kidneys and quietly losing them to damage. I'm Dr. Brian, and welcome to Channel Vital Science for Seniors. Today we'll walk together through the world of kidney medications in a way that makes sense, in a way that brings you hope. When I first explain to patients that their blood pressure medicine is, in fact, a kidney medicine, they often look surprised. "But doctor," they say, "isn't that just for the heart?" Here's the truth. High blood pressure is like a strong river current battering the walls of a dam. Over time, the constant pounding weakens the structure, carving cracks where water should never go. In the same way, elevated pressure inside your arteries batters the delicate blood vessels in your kidneys, the very filters that keep your body clean. Medicines such as ACE inhibitors and ARBs act like gentle hands, loosening the grip of that current, calming the force, and giving those fragile filters a chance to rest. Calcium channel blockers and beta blockers play their own roles, easing tension and lowering strain. I think of my patient, Maria, who came in with rising creatinine levels. Once her pressure was controlled, her kidney numbers steadied, buying her years of healthy living. These medicines don't just protect your heart, they guard your kidneys too, quiet guardians you carry in a pill box. One of the silent struggles of kidney disease is anemia. Patients often tell me, "Doctor, I feel exhausted just walking across the room." It's not just age or poor sleep, it's that their kidneys, normally the quiet conductors of red blood cell production, have stopped sending the signals. Imagine a factory where the lights go dim because no one flips the switch. Without the kidney's hormone, erythropoietin, the bone marrow slows down, red blood cells dwindle, and oxygen fails to reach muscles and brain. That's why kidney patients may look pale, feel weak, and lose the joy of simple activities. To restore balance, we use medicines called ESAs, which act like replacement conductors, raising the baton so the factory hums again. Alongside them, iron, whether by pill or infusion, becomes the raw material for those new cells. I recall Helen, who could barely climb stairs without resting. After treatment, she called me just to say, "I finally danced at my granddaughter's wedding." That is the power of correcting anemia. It gives back color, energy, and life itself. Phosphate sounds harmless, doesn't it? After all, it's in our food, our bones, even our cells. But when kidneys weaken, phosphate builds up like soot in a chimney, clogging the system and silently damaging the body. Excess phosphate hardens blood vessels, stiffens the heart, and weakens bones, creating the cruel irony of both fragile skeletons and clogged arteries. Patients sometimes ask me, "Why do I need another pill just for something invisible?" I explain that phosphate binders act like little magnets in the gut. As you eat, they catch the excess phosphate before it sneaks into the blood, carrying it out through the stool instead. There are calcium-based versions, like calcium acetate, and non-calcium ones such as sevelamer, which can even lower cholesterol as a side benefit. I think of George, a retired carpenter, who once broke his wrist from a minor fall. After careful phosphate control, his bone scans stabilized, and his risk of fractures declined. Science backs this up. Studies show lowering phosphate improves both survival and quality of life in chronic kidney disease. It may be invisible, but controlling phosphate protects you where it matters most, your heart and bones. Potassium is a mineral most of us rarely think about, yet it holds the rhythm of life in its hands. Every heartbeat, every muscle contraction relies on potassium being in just the right range. But when the kidneys falter, potassium levels climb, and that delicate rhythm can turn dangerous. I once had a patient, David, who came in feeling only a little weak. Within hours, his heart monitor showed irregular beats that could have turned deadly without quick action. That hidden thread is why we pay close attention to potassium. Medicines called potassium binders help by acting like sponges in the digestive tract. As food passes through, they trap extra potassium and escort it out through the stool. Older medicines like sodium polystyrene sulfonate can work, but newer ones, such as pataromer, tend to be gentler on the stomach. For patients, it feels like a safety net, lowering the risk of sudden, dangerous spikes. Combined with a diet mindful of low potassium foods, these treatments keep the heart steady, muscles strong, and life's rhythm in tune. Hyperkalemia may be silent at first, but with the right medicine, it doesn't have to steal your safety. Your bones are not just scaffolding. They are living banks where calcium and phosphate are deposited and withdrawn each day. Healthy kidneys act as the bankers, balancing deposits and withdrawals. But in chronic kidney disease, that bank mismanages its accounts. Calcium slips away, phosphate piles up, and the parathyroid glands begin shouting orders to pull even more calcium from the bones. The result is fragile skeletons, bone pain, and sometimes fractures that come from the simplest stumble. I remember Evelyn, who once broke a rib just from coughing. Her fear of moving nearly stole her independence. To correct this, we often use vitamin D analogs like calcitriol or pericalcital, which act like wise advisors, helping the body absorb calcium properly and quieting those overactive parathyroid glands. In some cases, calcimimetics like cinacalcet make the glands more sensitive to calcium, persuading them to calm their excessive demands. Research confirms that correcting these imbalances not only strengthens bones, but also reduces harmful calcium deposits in blood vessels. For patients, it means standing taller, walking steadier, and trusting their bodies again. Protecting the bones is more than comfort. It's the foundation of independence. Every breath you take, every bite of food you digest, produces tiny acids that the kidneys usually wash away. But when those kidneys slow, acid begins to pile up, like smoke in a room with no open window. This is metabolic acidosis, and though invisible, it quietly eats away at muscles, weakens bones, and saps energy. Patients sometimes tell me, "I just feel worn down, like my body's batteries never recharge." That fatigue isn't imaginary. It's the chemistry of the blood turning too acidic. To correct this, we often prescribe sodium bicarbonate, which may sound familiar because it's the same simple compound in baking soda. Inside the body, it releases bicarbonate ions that neutralize the extra acid, restoring balance to the bloodstream. I recall Mr. Lee, who once struggled to keep his blood pressure up and felt dizzy each morning. After steady bicarbonate treatment, his energy returned, and he could walk his neighborhood again without fear. Clinical studies show that correcting acidosis slows the decline of kidney function itself, buying precious time. So this isn't just about easing discomfort. It's about protecting the very engines of your body at the cellular level. Imagine a garden after a storm, with puddles of water collecting in the grass and pressing down the soil. That's what happens in the body when weakened kidneys can't clear excess fluid. It seeps into ankles, legs, even the lungs. Patients often come in with shoes that no longer fit, or they wake at night gasping for air because fluid has crept into their chest. I think of Clara, who once avoided leaving home because her swollen legs made walking painful. For her, diuretics became a lifeline. These medicines, often called water pills, work by nudging the kidneys to push out more salt and water through urine, draining those stubborn puddles. Loop diuretics, like furosemide, are powerful for advanced kidney disease, while thiazides help in earlier stages. The relief is often immediate, breathing easier, moving more freely, seeing the swelling recede. Yet the goal isn't just comfort. Studies show proper fluid control lowers strain on the heart and reduces hospitalizations. For many seniors, it means being able to take a morning walk, wear familiar shoes again, and reclaim the simple dignity of moving without heaviness. Diabetes is one of the leading villains behind kidney damage, slowly scarring those fragile filters over years. When blood sugar runs too high, it's like pouring syrup through a coffee filter. The thick stickiness clogs and strains until the filter breaks down. For someone already living with kidney disease, keeping sugar in check is not optional. It is survival. That's why newer medicines like SGLT2 inhibitors have been such a breakthrough. They work in the kidneys themselves, allowing extra sugar to slip out through urine rather than burdening the blood. Clinical studies in journals like the New England Journal of Medicine show that these drugs not only lower blood sugar, but also protect kidney function and reduce heart risk. Alongside them, insulin and other familiar medicines still play a role, carefully adjusted to match kidney capacity. I remember James, who worried his diabetes had sealed his fate. When we shifted his treatment, his creatinine stabilized, and he felt hope again. Pairing medication with a diet for kidney disease, balanced proteins, mindful carbs, creates a shield for both kidneys and heart. Diabetes may be fierce, but with the right tools, it doesn't get the last word. Cholesterol and triglycerides are like tiny travelers in the bloodstream, carrying energy and building blocks. But when their balance is lost, especially in kidney disease, they become more like reckless drivers, leaving dangerous traffic jams inside arteries. This buildup, called atherosclerosis, narrows the pathways that carry blood to the heart, brain, and kidneys themselves. For someone already living with reduced kidney function, that double hit raises the risk of heart attack or stroke sharply. That's where statins step in. These medicines lower LDL, the so-called bad cholesterol, and stabilize the roadway, preventing new blockages. I think of Patricia, a retired teacher who came to me frightened after her brother's sudden heart attack. Her cholesterol was high, and her kidney disease put her at risk. With statins and lifestyle shifts, her lipid numbers dropped, and she found comfort knowing she was steering clear of the same fate. Large studies like the SHARP trial confirm this. Statins reduce cardiovascular events in kidney patients. It's not about chasing perfect numbers. It's about guarding your future. For seniors, this means protecting memory, mobility, and the gift of more good years. The parathyroid glands are four tiny dots in your neck. Yet in kidney disease, they can become loud troublemakers. Normally, they whisper gentle instructions to keep calcium levels steady. But when kidneys fail to balance calcium and phosphate, those glands panic and begin shouting, pumping out too much parathyroid hormone, or PTH. The result is bones that weaken as calcium is pulled away, and blood vessels that stiffen with unwanted deposits. I remember Margaret, who once told me, "Doctor, I feel like my bones are turning to chalk." She wasn't far off. To calm the glands, we often use vitamin D analogs like calcitriol or pericalcital, which guide the body to absorb calcium more effectively and quiet the overreaction. In other cases, calcimimetics like Sinicalcet make the glands more sensitive, so they don't have to shout so loudly. The change can be dramatic: less bone pain, improved lab numbers, fewer fractures. Research shows that treating SHPT reduces both skeletal complications and cardiovascular risk. For patients, it means not living in fear of the next fall and regaining trust in their own bodies to carry them safely through everyday life. Sometimes the greatest burden of kidney disease isn't the lab numbers, but the daily discomforts that steal joy. Pain, itching, restless legs. These can quietly erode quality of life. I remember Samuel, who had advanced kidney disease, and confessed that the constant itching drove him to tears at night. "It's like my skin is crawling," he said. For him, medications aimed not at survival, but at comfort were life-changing. Simple pain relievers like acetaminophen can make moving through the day easier, while special antipruritic medicines ease the torment of itching. These treatments may not show up in bold on a lab report, but they restore dignity and rest. Science backs this too. Addressing symptoms reduces depression and improves overall well-being, even in dialysis patients. When people feel relief, they move more, laugh more, and reconnect with loved ones. Managing symptoms reminds us that medicine is not just about extending life, but about improving the days we're given. For many seniors, this is the difference between enduring each day and truly living it. Finding comfort enough to sit in the garden, play with grandchildren, or sleep peacefully again. One truth I always emphasize is that kidney health changes how medicine behaves in the body. Think of your kidneys as skilled gatekeepers, deciding how long a drug should stay and when it should leave. When those gatekeepers slow down, even normal doses can build up like guests who never leave the party, leading to side effects or even toxicity. That's why doctors adjust prescriptions according to your glomerular filtration rate, or GFR. It isn't about depriving you of treatment, It's about tailoring the dose to keep you safe. Personalized dosing means the medicine helps without becoming a hidden burden. Just as some medicines heal, others can quietly harm weakened kidneys. Non-steroidal anti-inflammatory drugs like ibuprofen, often taken for joint pain, can reduce blood flow and accelerate kidney decline. Certain antibiotics, especially aminoglycosides when used for long periods, may injure the very filters we're trying to protect. Even contrast dyes used in imaging can pose risks if kidneys are already fragile. Patients sometimes ask, but it's over the counter, so it must be safe? Not always. Knowing what to avoid is as important as knowing what to take, because protecting kidney function is also about guarding against hidden enemies. We've traveled together through the complex world of kidney medications, from blood pressure pills to life-saving binders and symptom relievers. The message I want you to carry is this: every medicine has a purpose, but its true power comes from being used wisely, in partnership with your doctor. Protecting your kidneys isn't about fear, it's about hope, about adding strength to your years, not just years to your life. I'm Dr. Brian, and I believe your best health is still ahead. Take courage, ask questions, and remember, you are never too old to reclaim your vitality.